Welcome everyone to our first colloquium this month. And today we have Paula Schwenke. She will speak on designing a free online course on planetary health as a science communication method. Ms. Schwenke designed the course for the VHB, so the Virtual University of Bavaria, about planetary health. And today she will give us insights into the development, implementation, and evaluation of the course as a science communication format. Free accessible online courses offer an easy opportunity to implement the relevant and interdisciplinary topic of planetary health independently from the human or financial resources of the university. Paula Schwenke has a master's degree in public health and is a scientific research associate at the Chair for Public Health and Health Services Research at the LMU, focused on planetary health. Welcome, Paula, and now I will put the presentation up for you.
Thank you, Paulina, for this introduction. Also, hello from my side. I'm just in holidays in Spain, so I just hope the internet connection will last and will be fine. Otherwise, you just interrupt me, Paulina. Yes, so welcome to my presentation about how we designed our online course about planetary health. Yeah, you can already make the next slide. As Paulina already introduced me, I just wanted to very briefly introduce myself. Also, as Paulina said, I'm a research associate at the Chair of Public Health and Health Service Research at the LMU. And also I'm a co-owner of the company Rocket Education. And I do in the university a lot with planetary health education, as well as with my own company, but there the target is more on schools and in the university more on students. Next slide. So I just quick go through the agenda with you. I don't know from which backgrounds you are all coming, so I will just make a brief introduction into planetary health so that we are all on the same level and know what I'm talking about. Then I will quickly just tell why planetary health teaching is so important. Then I will tell something about the development of our online course and how we implemented this course. And also in the end, I will give you a brief insight on our evaluation we already made this semester and last semester. And then, of course, I will be here for questions or discussion. Yeah, next slide. So yeah, this is the Lancet definition of planetary health. It's quite long, but I will just introduce you to the very short definition. It's planetary health is the health of the human civilization, but also the state of the natural systems on which our health depends. Next slide. So this is just a very nice logo from the planetary health definition, and also what I just said very shortly. So this is a very complex graphic. You don't have to look at it in detail, but it just shows here is the focus on climate change. So we have climate change as one big boundary, but we also have other boundaries like the biodiversity loss and so on. And here you see, for example, like climate changes raise the average and extreme temperatures, whereas it comes to more extreme weather events like floodings, heat waves, droughts. And this can lead, as I said, like to biodiversity loss. And also, of course, it has a huge impact on our health. So, for example, if we have too much heat waves or floodings, the agricultural productivity is reduced, so we could have malnutrition and so on. But we also, of course, have social mediation factors like, when we have huge fires, it's very easy to understand that the people can't live there anymore, for example. So we might have also mass migrations and so on. So this is just very briefly to show the relations between all the natural systems where our health depends on. Next slide, please. So yeah, we come already to the planetary health teaching. Next slide. And why it's so important to improve the planetary health teaching, because as you already, or probably because you're here, that's also why, because your interest in planetary health education is rising and it's emerging more and more, and we really need the planetary health education to prepare our systems of the future. especially in the healthcare sector, like for the healthcare systems and so on, but also in other departments, as it's a very interdisciplinary topic, like also city planners and their employees and so on. And they must be prepared to deal with the health risks we will be tackling with. So, and also we are very, very important potential communicators between the policies, the sciences, but also the society. And that's why we need to transfer this science communication into the society. And that's why also the education is a very good method to adapt the science. We do the research to like the society, to the public, to all of the study programs. Because especially the health professionals, as they have a lot of trust within society, but also other professions, of course, they are key persons in leading the transformative change for planetary health, because they are so important communicators. As I already mentioned briefly, that the educational institutions like universities, for example, but also as like schools, they have a major responsibility to embed the planetary health in their education, in their mandatory subjects, so that all the people who do the study programs, they need what urgent need is for this transformative change, and also just that they know, like when heat waves, for example, comes up, what those also have to do with our health. Next point. Yes, so we really try to train the students who do our course to become change agents, who not only knows more about planetary health, but who also actively drives like the planetary health transformation to achieve the sustainable health goals, so that we can have a healthier society and of course a healthier planet at the same time. Yes, so now I want to just show you how we developed the course, and we started with a needs assessment on planetary health at universities in Bavaria. We had in total almost 1,500 students who participated in this survey, and we asked them different questions regarding planetary health. And I have some of you brought here with me. For example, have you heard of planetary health? And only 22% already have heard of planetary health. So that's not much. And like most of the people, like 67% have not heard from it at all. And 11% didn't know. And then also, which is very interesting, we asked them, but are you interested in learning more about the topic planetary health? Then, of course, we gave them a quick introduction what planetary health is. And then you see like the yellow and the orange parts, it's more than 3/4 who are really interested in learn more about the topic. And on the third graph, you see also how important they think about the embedding of those topics within their studies. And also there you see it's almost 3/4 who really would love to have those topics embedded in their study programs. Yes, also we ask, we have already prepared a lot of topics, which you see here. I think the graph is also quite small, but you don't have to reach through it all. And they could choose like which topics they thought they would be most interested in, and also would be most important to embed in the course. And of course, as so many people students didn't even know what planetary health is, the general association between health and climate change and the environment was the most asked topic. But also what we were really surprised about was mental health. So, and that was a topic we didn't had on our agenda before the survey, but after the survey, we of course added another chapter with mental health and climate change and mental health and planetary health, as the students were really, really interested in it. Of course, the survey was conducted like in the end parts of the COVID-19 pandemic. So this is also probably one part which might have driven the mental health topic to more interest than it might have been before COVID-19, but we don't really know how much this affected the choice of topics. Yes, so we also asked about the previous knowledge and the contact with planetary health. And here you see on the left side, it's like the study programs we who were part of the survey. And on the right part, you see on the left side, you see the previous knowledge of planetary health within their study programs. On the right side, you see if they already were in contact with planetary health within their study programs. And you really can see that the previous knowledge of planetary health is higher if the study programs, if they already learned something about it in the study programs. So we really thought that this is a very, very good point. Like when the students want to gain more knowledge and want to become change agents, that you implement it in their study programs, as it seems to, be really one driver for the knowledge. Next slide, please. We also, publish the results. You can see it in our publication. It's either with the QR code or also the link below. I also have it in the references. You probably will get the presentation, so you can just have a look at the graphs I showed you more detailed in this publication. Next slide, please. And which is also, it's in German apparently, but which is also a very good guideline for, like more detailed guidance and a very good examples and so on, is this guideline from Klug, from the German Association of Climate Change and Health. I also put the link below. So yes, now I want to show you some impressions from the course, that you just know what I'm talking about. And we have developed one course, but it's like separated in two versions. The first version is the classic VRB course. It's only for students who are in study programs at the moment. You can make an exam in the end, so you get a grade. It's with 3 ETCS or 3 weekly hour semester Wochenstunden. I don't know the proper word in English, but so it's very good to just implement it as an elective, for example. But we also have the open version, which is open for everyone. So you can just go on the site of the Virtuelle Hochschule Bayern, and it's like 20 hours processing time. You get a certificate in the end. And this is also really easy to access, for everyone, and also to implement for universities outside of Bavaria, because the Virtuelle Hochschule Bayern is mostly for partner universities in Bavaria when you want to have the classic course, where we do the exam grading and so on. So the classic course is via the Moodle system of the universities. So the classic version doesn't look as good as the open version, because the open version is via the Virtuelle Hochschule Bayern platform. But also the classic version is very interactive, as you see on the right picture below. And you can look through all the chapters as a student. You have to do some little tests in the end of each chapter, that we know that the students also really worked through the chapters as they do it on their own. And we added a lot of videos and little quizzes, and yes. The open course, the open course, as I said, is on the platform of the Virtuelle Hochschule Bayern. So this looks a little bit nicer, but it's like the same content, just reduced. So it's not as detailed as the classic course, and therefore it also only takes 20 hours. But we also have already quite some universities who implemented this course in their study programs, and they do the exam, for example, themselves. So they don't need any resources in teaching planetary health. So all the knowledge comes via our course, but they do the assignments or the exam in the end. They thought about themselves, and they also corrected themselves. Yes, so you can go on steps. Yeah, perfect. So now you already saw the courses, so you know like what our goal was and what we developed. And now I want to just briefly go like which steps we took to develop this course, because it's not that difficult. And I think also, of course, you could use the course you already have, but also if you want to have another focus, for example, or I don't know, I just want to really motivate you to just start, because yeah, we just started with a literature research to, of course, know the actual topics and what the students might be interested in. Then we did the needs assessment I already presented to you, just to see if the literature research matched the real interests of the students. Then we specified the agenda, and then we also interviewed a lot of experts and like recorded the interviews and did the video creation out of this. So you could maybe go to the next slide, because then I say a bit further to the expert interviews. So we conducted all of the expert interviews via Zoom and recorded them. And in the end, we did a transcript from the videos and really cutted them like very lightly, so that the students don't have to look through 45 minutes of interview, so that they only had the most important and relevant informations together. And we also had a speaker, like you see the girl on the left upper side or the boy on the right upper side, to guide the students or the viewer through the interviews. So they are really, they are not very long, and we really tried to gain the most important and relevant informations in a very short video. And those videos we also embedded in the course. And then we did, of course, additionally to the interviews, we created videos where we took in a lot of graphs, we did a lot of animations, and we had a video creator with us who helped us with all those video creations. And we tried to do it a little bit like the YouTube style. So not that it's just a recorded lecture, but that it's more interactive and faster, and more changes in, when someone speaks, that you don't only see the person, that you always see a lot of examples and graphs right away. When we finished the creation of the videos, we embedded all the contents in the Moodle course, and of course also in the open version. But that was also quite easy, because you could just copy the all of the contents from the Moodle course into the open version. So when you work with H5P, it's called, it's like, one software, I don't know, I don't want to go further into this, but if you know how to work with this, it's really easy, because you can copy it in every other system and change the agenda and all the small contents inside the course. Then, of course, we tried to create an exam, which is not only multiple choice, because we thought this is not really matching with us, that we want the students to become change agents. So the students at the LMU, for example, they write an essay, they can choose the topic themselves, and we always try to push them to choose a topic where they work in any ways, or which they can use later and really like transform the theoretical essay into practical steps. They also can, of course, already do like interviews with politicians and then just write about how this went. But we also have partner universities, and they do also other assignments. So we don't all do the same. And they also, for example, do planetary health communication. So they have to do interviews, or they have to speak with people who are not so into planetary health yet, and then talk about it. So there are a lot of different possibilities. And if you're interested in the exams we use, you can also just write an email to me afterwards, and then I can just send you the list. Or also, of course, look at the guidance I showed you from Klug, from the German Alliance from Climate Change and Health. They also have a lot of examples for assignments. And then a very important point was the course promotion. So we looked up a lot of universities, a lot of email addresses, and sent informations to everyone we could get. and there came also a lot of response. So that was also very important that the course, not only for our students, so that it also got implemented in more and more universities. And then in the end, the evaluation. So you can do 2 slides further already. Yes. So we have a pre and a post survey, but as you see, the post survey, as the semester is still running, we just could conduct 21 responses yet. So the other students will follow in the end of July. So yeah, in total we had 119 pre-survey students and 21 post-survey, and from different universities, as you see. We have like all of those are our partner universities. You see written out, and then we also have others. It's 9.3% so far, and they are really from all of Germany, Bavaria, students where the subject is not implemented yet as an elective or so, but they sometimes also have the possibility to embed grades from other courses. Yes, so the most students we had implemented so far were medical students, but we also have, of course, public health students, epidemiology students, but also geographics students, where the course is already embedded as a mandatory course or an elective. But also, yeah, we also have others here, and this is really throughout the study programs. It's very diverse. Yeah, so this is also in German, the words, but I just will translate the most important words. And you see on the left side the pre-survey, on the right side the post-survey, and this is, we asked what emotions do you feel about climate change? And I just want to pick out 2 of the emotions. The first row is like how they feel helpless. And there you really see on the pre-survey, 63% of the students feel helpless. And on the post-survey, of course, it's still very less people who answered the post-survey. I'm curious how it will change when all the students have answered it. But so far, the students who feel helpless really reduced after the course. And also, there's this row, Tatendrang in German. So it just shows how the students feel about getting involved and do things. And this was before the course around 35%, and after the course over 70%. So really, I hope that this shows that the students really got a lot of ideas and want to become more active after the course. But yeah, we'll see how the evaluation will end up when all the students have answered it this semester. Next slide. Also, we ask like if they feel in their professional role that they have important social responsibility regarding the climate change. And also the first column shows before the course and the second one after the course. And also this increased so that they really feel more responsible in their professional role. Next slide, please. We also asked them if they already are socially engaged, like in Health for Future, Fridays for Future, Greenpeace, or whatever. This didn't change much so far, just a little bit. So we also hope that we can get the people more engaged after the course. But yeah, we just have to see how the evaluation, the results are after the survey is conducted with all the students. And if it's still just a slight increase, we could think of adding some more features into the course so that they have the contact addresses right away from associations or groups where they can just find their change agents which are on the same path than they are, so they don't have to do everything on their own. We also asked about the reasons why they chose the course. The main reasons were that they were really interested in the topic for a long time already, that it's just a very important political topic. Sorry, there's a typo in it. And also that the online course format suits them very well. So I think this is also a very important point, because they can do they can have a look at the course whenever they want, so that it's not like fixed dates. but also we have every month we have the opportunity, which is not mandatory, but still a lot of students join this with a Zoom meeting where we also invite experts, so they can also like discuss more and so on. But I think that it's just remote possible, and an online course, it's also a very important point for them to choose it. So yes, that was already how we developed the course, what the evaluation says so far, and I'm happy to answer your questions, or thank you for your attention.